How to survive a brain stroke alone. After 60, 7 life-saving tips every senior must know. You're in your kitchen on a quiet morning, maybe waiting for your coffee to finish brewing or thinking about the day ahead. Everything feels normal, just another peaceful start, and then, almost out of nowhere, something feels off. Maybe your hand feels a little heavier than usual. Maybe a word doesn't come out as clearly. Maybe your balance shifts in a way you didn't expect. It's subtle, but it's enough to make you pause. For so many seniors, that tiny moment becomes the beginning of something serious. Because strokes don't send any warnings. They don't announce themselves with alarms or bright lights. They simply arrive. Often when someone is alone, and they can change life in a matter of seconds. That's why talking about this matters. Not to frighten you, but to help you feel prepared and steady when life throws something unexpected your way. If this sounds like something you felt too, you're not alone, and that's why we're here. Tap that thumbs up if you'd like more gentle tips like this. Now, let's talk about what you can start doing today. Many people are surprised to learn that most stroke survivors had a chance to recover well simply because they acted quickly. Doctors often talk about a short period sometimes called the golden window. It's the first few minutes when your brain is begging for help, and the choices you make in that tiny slice of time can make an enormous difference. That's why this video exists. Not to overwhelm you with medical jargon, but to offer clear, simple steps backed by solid research. Steps that any senior, whether living alone or with family, can learn and practice. It's normal to feel nervous when talking about something as serious as a stroke, but the real story here isn't fear. It's that your actions, even small ones, can protect your independence, your memory, and your everyday joys. In the next few minutes, you'll learn several practical tools you can use the moment something feels wrong. You'll see how to check yourself quickly, how to stay safe while waiting for help, and how to position your body to support your brain. You'll learn a calm breathing pattern that helps keep oxygen flowing and what common habits to avoid, even if they seem harmless. And you'll hear about a simple mental technique that helps your brain stay active during those early moments. Everything is explained in a gentle, senior-friendly way, using real science that doctors rely on every day. Let's take a steady breath together and move into the first step, something easy, something you can practice right now, and something that could one day protect your life. The 1-minute self-check that saves lives. When something doesn't feel quite right in your body, even if it seems small, a simple 1-minute check can give you clarity fast. Doctors across the country rely on a quick set of tests to spot trouble early, and you can use the same approach at home. Think of it like checking the oil in your car or making sure the front door is locked before bedtime. It's a small habit that can prevent something far more serious. So let's walk through it together in a calm, steady way that you can remember even on a stressful morning. The first part is your smile. If you ever feel unusually tired, dizzy, or just off, try looking at yourself for a moment. You can use your phone's front camera, a mirror near the hallway, or the reflection on a dark screen. Give yourself a gentle smile, the same kind you might share with a grandchild or a friendly neighbor. You don't need to force it, just let it happen naturally. If one side of your mouth doesn't move the way it usually does, or seems slower than the other, that can be a sign your brain isn't sending signals evenly. It's a small clue, but it's one of the earliest and clearest ones doctors look for. Next, lift both arms straight in front of you. Keep them relaxed, like you're reaching out to greet someone or hold a light grocery bag. Close your eyes for a moment and take a breath. If one arm begins to drift downward or feels heavier, that difference matters. It's not about strength or fitness. It's about whether both sides of your body are working together the way they always have. Even a slight change is worth paying attention to. After that, say a simple, familiar sentence out loud. It can be something as easy as talking about the weather or describing what you're cooking for dinner. The point is to hear whether your words come out clear and smooth. If you notice slurring or you can't get the words out the way you intend, that's another early signal doctors take very seriously. Speech, facial movement, and arm strength all rely on blood flow to specific areas of the brain, and these little checks can reveal problems before they become overwhelming. What's reassuring is that this small routine is the same kind of assessment used in emergency rooms. Nurses and paramedics use it because it works. It catches issues quickly, even when symptoms feel vague. And the more familiar you become with it, the more confident you'll feel. Practicing it once a day, maybe when you finish brushing your teeth or while waiting for your morning oatmeal to cool, helps build a steady habit. You're not looking for trouble. You're simply keeping watch over your own well-being in a gentle, thoughtful way. If any part of this quick check feels unusual, even slightly, it's worth acting on right away. Those early moments are when you have the most power to protect your brain and your independence. In the next section, we'll talk about the very first action to take if something doesn't look or feel right, the step that gives you the fastest path to help when every minute matters. Calling 911. First, the critical choice. Once you've done that quick self-check and something feels wrong, the most important thing you can do is call 911. Nothing else comes close in terms of protecting your brain and your future independence. Many seniors tell themselves they should call a child, a neighbor, or a spouse first, just to see what they think. It's a natural instinct. You want someone who knows you to help make sense of what you're feeling. But every minute spent dialing a family member is a minute your brain is losing precious oxygen. Even the kindest, most caring loved one cannot give you the medical treatment you need in those early moments. Only trained responders can do that, and they can't arrive until you reach out directly. Think about how long it takes to get someone on the phone these days. Maybe their ringer is off. Maybe they're at the grocery store with their hands full. Maybe they don't recognize the number because you're calling from a landline. Even a few minutes of waiting or calling back can create a delay that truly changes the outcome. I've heard so many stories from seniors who thought they were doing the right thing by calling a family member first, only to find out later that those extra minutes made their symptoms worse or limited their recovery. On the other hand, the people who picked up the phone and dialed 911 right away often arrived at the hospital sooner, got treatment faster, and walked out with less long-term damage. The good news is that you can make this step easier without needing to think much in the moment. Most phones today allow you to add 911 to your favorites or speed dial list. Voice commands can help too, especially if your hands feel clumsy or numb. With a simple "Hey Siri," call 911 or "OK Google." Call 911, you can reach emergency services even if holding the phone is difficult. It's worth practicing that once or twice when you're calm, just like you might rehearse an evacuation route during storm season or double-check batteries in a smoke alarm. These are preventive habits, not signs of fear. When you speak to the dispatcher, even if your voice feels shaky, try to say that you think you may be having stroke symptoms. That short sentence tells them exactly how serious the situation is. If your speech is hard to understand, stay on the line. They can still send help to your location and begin guiding you through the next steps. If you live in a larger home or a place with multiple rooms, naming where you are helps too. Something as simple as "I'm in the living room near the back door" can save responders time. And in moments like these, saved time can mean saved brain cells, saved mobility, and saved independence. It's completely understandable to want to reach for reassurance from someone you love. But the safest, strongest act of self-care in a moment of uncertainty is calling 911 without hesitation. In the next section, we'll talk about what you can do in those minutes while help is on the way. Small choices that keep your body safer and support your brain until trained hands arrive. Safe actions you can take while help is coming. Once you've called 911, the next few minutes are about keeping your body as safe and supported as possible. You don't need to be perfect, and you don't need to remember a long list of instructions. A few simple actions, done gently and without rushing, can help protect your brain until trained medical teams arrive. One of the first things doctors often talk about is aspirin, but it's important to understand when it's appropriate. If you're not on blood thinners and you haven't had any recent head injuries, one regular strength aspirin can sometimes help slow the growth of a clot. The key is chewing it, not swallowing it whole. Chewing allows your body to absorb it faster, which is important during those early moments. If swallowing feels difficult, though, do not force it. Safety comes first. And if you already take prescription blood thinners, this is one step you should skip entirely. Because these decisions can feel overwhelming in an emergency, it's helpful to think ahead during everyday life. Many seniors keep a small bottle of regular aspirin in easy places, a nightstand drawer, a kitchen counter, or the glove compartment of a car. The point isn't to create worry, but to make sure that if you ever need it, you don't have to search. A little preparation can spare you from having to make decisions under stress. While you're checking your medicine cabinet, it's a good idea to make sure the bottle isn't expired. Fresh medication works the way it's supposed to. Old pills may not. After thinking about aspirin, the next thing to focus on is your position. Once a stroke begins, balance can change very suddenly, so it's safer not to walk around or try to move from room to room. Find the nearest place where you can lower yourself gently to the floor or a soft surface. The safest posture is lying on your left side with your head slightly raised. A folded blanket, a small throw pillow, or even a rolled-up sweater can work. This angle helps maintain better blood flow to your brain while preventing pressure from building up. It also protects your airway. When you lie flat or on your back, there's a greater chance of swallowing difficulties or accidental choking, especially if your throat muscles weaken for a moment. Being on your left side keeps breathing smoother and more natural. This position also prevents falls if you become lightheaded. Many seniors have shared how grateful they were to already be on the ground instead of trying to stand when their legs suddenly weakened. Keeping a few small pillows or soft blankets within reach of your favorite sitting spots is a simple way to make this easier. Think about the places where you relax most often, like the couch where you read the newspaper, or the recliner where you watch your evening shows. It doesn't take much preparation, just a quiet decision to make safety convenient. These steps aren't meant to replace professional care. They simply buy your brain time until help arrives. In the next part, we'll talk about a calm breathing pattern that helps your body stay steady, even when your mind feels overwhelmed, and how it supports your brain during moments of stress. The breathing pattern that helps protect your brain. In moments of stress, especially when something feels wrong in your body, it's natural for your breathing to speed up. Many seniors describe it as a quick flutter in the chest or a sense that they can't quite get enough air. But fast breathing, even though it feels instinctive, can actually make stroke symptoms worse by lowering the amount of oxygen reaching the brain. That's why learning a simple, steady breathing pattern ahead of time can be so valuable. The method many doctors recommend is sometimes called 7-7-7 breathing, and it's gentle enough for anyone to practice. Here's how it works. You take a slow breath in through your nose for a count of 7. Then you hold that breath, softly and without strain, for another count of 7. And finally, you exhale through your mouth for a count of 7. The rhythm is calm and even, almost like the relaxed pace you might fall into during a peaceful walk through the neighborhood or while sitting on the porch enjoying the late afternoon breeze. This pattern helps your body avoid the rapid, shallow breaths that happen during panic. Instead, it keeps oxygen moving steadily and prevents the pressure inside your head from rising too quickly. Researchers have found that controlled breathing like this can support healthier circulation and prevent sudden shifts in blood flow that can worsen symptoms. When you slow your breath, your heart follows along, easing into a more stable rhythm. That stability matters during stress. It gives your brain a better chance of getting the oxygen it needs. Even when something is interfering with normal blood flow, you don't have to think about any of the science in a scary way. Just imagine your breath acting like a gentle anchor, helping your body stay grounded until help arrives. The best time to learn this technique is when you're feeling well. Maybe during your morning routine, while waiting for water to boil for tea, or in the quiet moments before bedtime. Practicing a few rounds once or twice a day helps make the pattern familiar. Then, if you ever need it during an emergency, your body will remember what to do, even if your mind feels cloudy. Many seniors say practicing it brings a sense of calm to their everyday life. 2. Not just during stressful moments. You don't have to get the count perfect. What matters is the pace slow in gentle hold, slow out. With each breath, you're giving your brain a little more support and keeping your body from slipping into panic. In the next section, we'll talk about a few common habits that seem harmless but can actually make stroke symptoms much worse, and why avoiding them is just as important as the steps you take. What not to do: 5 common mistakes that make strokes worse. When something frightening or confusing is happening in your body, it's natural to reach for familiar habits. You might want a sip of water, your usual medications, a quick drive to the hospital, or the comfort of lying down for a nap. But during a stroke, these everyday actions can work against you in ways that aren't obvious. Understanding why can help you stay safer in those early minutes before help arrives. And you don't need to memorize anything complicated. One of the most common instincts is to take a drink of water, especially if your mouth suddenly feels dry. But strokes can affect the muscles in your throat, sometimes making swallowing less reliable. Water that accidentally goes down the wrong way can enter the lungs and lead to dangerous complications. Even small sips can be risky, so it's best to avoid drinking until medical teams can check your swallowing safely. Another instinct is to reach for blood pressure medication. Many seniors keep these pills close by, and the idea of bringing the numbers down can feel helpful. But during a stroke, a sudden drop in blood pressure can reduce blood flow to areas of the brain that are already struggling. It's one of those surprising moments when something normally good for you becomes unhelpful. Only trained professionals can safely decide when blood pressure should be lowered during a stroke. Driving yourself is another action that seems reasonable at first. Many people think, I can get to the ER faster on my own, but strokes can change coordination and alertness in seconds. Even a short drive down a familiar street can become dangerous. It's far safer to stay where you are and let emergency responders reach you. They can begin care right away, long before a hospital room becomes available. Trying to finish a small chore or walking to another part of the house can be tempting too. Maybe you were folding laundry, or stirring a pot of soup, or heading toward the bedroom when symptoms began. But any extra movement can raise your blood pressure or increase the risk of falling. It's better to stay where you are, settle gently into a safe position, and focus on slow, steady breathing until help arrives. Going to bed is another common choice. Seniors often tell themselves they just need a moment to rest, but lying down to sleep it off can delay care at a critical time. Symptoms rarely improve with rest during a stroke, and sleeping can make it harder for someone to check in on you if you live alone. A simple way to remember these points is to place small notes in the places you visit, often the refrigerator, the bathroom mirror, or the bedside table. Gentle reminders like "don't drink during symptoms" or "call 911 first" can guide you on a stressful day. In the next section, we'll talk about a powerful technique you can use even if one side of your body stops responding, a tool that helps your brain stay active until medical help takes over. Using visualization to support recovery. There's one more tool you can lean on while you wait for help, and it doesn't require strength, special equipment, or even the ability to move. It's something many physical therapists and neurologists encourage because it supports the brain during stressful moments. It's the simple act of imagining movement, even if a hand won't lift or a foot won't respond. Picturing that motion in your mind can help keep healthy parts of your brain active. Researchers have shown that imagining movement lights up many of the same areas of the brain as actually doing it, almost like the brain is rehearsing the motion and keeping the pathways warm. If one side of your body feels weak or still, you can close your eyes and picture the muscles working the way they always have. You might imagine your fingers spreading apart, then curling gently into a fist. You could picture lifting your arm the way you do when you reach for a mug in the kitchen cabinet or when you wave hello to a neighbor across the yard. If the weakness is in your leg, you can imagine taking a steady step forward, feeling your foot press into the ground, and then taking another step. These mental pictures don't have to be perfect. They just have to be clear enough that you can see yourself doing the motion you want your body to remember. What's powerful about this technique is that it gives you something active to focus on when everything else feels out of your control. It keeps your mind engaged and directs your energy toward healing instead of fear. Many seniors who've practiced visualization during physical therapy say it helped them reconnect with their bodies and regain confidence. During a stroke, it simply adds another layer of support until trained hands take over. If you're worried you might forget how to do this in the moment, you can prepare ahead of time. Some people like to download short audio guides or save a recording of themselves walking through a few movements. Having something you can tap on your phone makes the process easier, especially if you feel confused or overwhelmed. The goal isn't to fix anything on your own. It's to help your brain stay active and ready for recovery. Now that you've learned the key steps to take and the ones to avoid, there's one last piece to bring everything together, a gentle, hopeful reminder of how these small actions protect your independence and peace of mind. When we put everything together, the steps you've learned form a simple but powerful plan. It starts with that quick self-check, the 1-minute moment that helps you recognize when something isn't right. From there, calling 911 becomes your lifeline, bringing trained help straight to you. While you wait, chewing a regular aspirin only if it's safe for your situation, and settling into the left side position with your head gently raised gives your brain the best support possible. Keeping your breathing slow and steady protects your oxygen levels, and avoiding everyday habits like drinking water, taking extra medications, or trying to push through chores helps prevent things from getting worse. And finally, visualization gives your mind a way to stay connected to your body, even when movement is difficult. These tools are simple, backed by real science, and they can make a meaningful difference in how well someone recovers. The heart of this message isn't fear, it's empowerment. Knowing what to do gives you a sense of control and calm, especially for those living alone or spending long stretches of the day by themselves. Preparation is a form of peace of mind. It's like keeping a spare flashlight in the kitchen drawer or checking the batteries in the smoke alarm. You hope you never need it, but having it ready brings comfort. And the fact that you stayed with this video and learned these steps says a lot about your strength, your resilience, and your care for your own future. You're giving yourself the gift of readiness, and that deserves acknowledgement. Before we close, I invite you to share your own experiences or thoughts in the comments. You never know who might read your words and feel supported or less alone. And if you'd like gentle, trustworthy health guidance designed especially for life after 60, consider subscribing or passing this along to someone you care about. I'm grateful you chose to be here today. Take what feels right, leave what doesn't, and keep moving forward with kindness and curiosity.